Of the coronavirus pandemic, gun sales, they've been on the rise. But until now, gun stores were considered non-essential. Well, now the federal government has decided those businesses are essential services. All the confusion started when some states failed to specifically mention gun stores in their list of approved businesses. The new rules mean that selling and importing guns, that's now legal, and that shooting ranges are considered critical infrastructure. The FBI says that it has done 3.7 million background checks in March alone. That is the highest number since it started. And on the heels of last week's dismal unemployment report, the Department of Labor will release the latest number of claims today. According to USA Today, analysts expect anywhere from 3.5 to 4 million new claims, and that is just for 1 week. Last week, 3.3 million people filed for unemployment. Those figures will be released at 8:30, and we will bring them to you live during Eyewitness News this morning. Tomorrow, we will get the numbers for the entire month. And President Trump says the government's stockpile of personal protective equipment is nearly depleted because the government is shipping those items directly to hospitals. Well, now he is telling states to start finding those essential items on their own.
Well, many of the states have people that, whether it's that or clothing, they make clothing, lots of clothing in many of the different states. We said, see if you can get it directly from those manufacturers. Make a deal.
Now, that shortage of personal protective equipment, it's impacting local hospitals too, and it is prompting one Charlotte doctor to get creative about finding those precious resources. Eyewitness News reporter Anthony Costora live for us just outside of the Goodwill in West Charlotte. And Anthony, this is where a special donation drive will start later today.
Right, Brittany. And last week, Goodwill locations actually closed their doors because of the coronavirus pandemic. But as you mentioned today, this location and another in Ballantyne will reopen to collect that crucial protective gear for healthcare workers that's so desperately needed. This donation drive all started when the outpatient practice Dr. Sheila Natarajan works in switched to telemedicine. Her office didn't need the gear it had, so they donated it all. She even set out donation boxes in front of her home to collect N95 masks and other protective gear like gowns and gloves. The doctor suspected health care workers might see a shortage, but she didn't expect it to arrive as quickly as it did. Now she's hoping the community really steps in to help doctors and nurses working on the front lines.
Thanks.
We scrounged around, tried to find whatever we had available since we didn't need it at our clinic anymore, and gave that to them. And we literally only have days. And so we are trying to amass as much as we can.
Goodwill decided to jump on board starting today on Thursdays and Saturdays from noon to 4. This location on Wilkinson Boulevard in West Charlotte and the one on Lancaster Highway in Ballantyne will open their doors to accept that PPE donation. Now, the doctor is hoping people will look inside their own homes to see what protective gear they may have, and then, of course, hopefully donate it. Brittany?
Certainly, they need all the help they can get. Anthony, thank you. In this situation, it is so bad that nurses from hospitals in 7 states, including North Carolina, they are protesting the lack of preparedness and protective gear. Some of those nurses say that they are being threatened for voicing their concerns.
Among nurses and doctors, there is a fear of speaking out.
What are you afraid that will happen?
I guess people are afraid they might lose their job. I'm personally more afraid of losing my life or losing my daughter.
Well, some leading hospital groups say these are extraordinary times, and they are doing everything they can to protect staff. And gaps in our healthcare system could hit rural communities especially hard. An AP report found 170 rural hospitals across the country closed in the past 15 years. The majority were in the South and Appalachia, and the reasons stretch from medical costs to low payments from Medicare. But that means it leaves about 15% of the U.S. population further away from community hospitals, and those communities already have a higher rate of pre-existing conditions like chronic respiratory illness and heart disease. Yesterday, Mecklenburg County reported its 2nd death from coronavirus, prompting another plea from state officials. Stay at home if you can to help flatten the curve. The state has nearly 1,600 cases and at least 10 deaths. You can see there Mecklenburg County has 465 of those cases. And if you look at South Carolina, nearly 1,300 people have tested positive statewide. That includes 66 in York County. And one of those new COVID-19 cases in Mecklenburg County, it is a Medic employee. Medic tells us that person was last in an ambulance 1 week ago today. The worker started showing symptoms on Sunday, then tested positive on Monday. They said the other paramedic they were working with has not shown symptoms and is not in quarantine. Medic says the employee will be paid while they recover.
We knew that this was going to be an unfortunate byproduct of this crisis, and we're prepared to deal with this employee and their needs and the needs of all of our employees who are out there on the front line every day exposed to this illness.
The medic says that it does not plan to notify the patients that paramedic came into contact with because they didn't have any symptoms on the job. Overwhelmed hospitals in New York are now getting help from Boone-based Samaritan's Purse. Patients from Mount Sinai Hospital are being moved to the organization's field hospital in Central Park. It has 68 beds and a special respiratory care unit. A team got to New York just 6 days ago to prepare this field hospital for patients. And this next story, it's hard to believe. Federal officials arrested a train engineer they say tried to crash a train into the USNS Mercy in Los Angeles. That's the Navy ship that's stationed there to help overwhelmed hospitals. Just take a look at some of the video here. You can see there that train off the tracks there. This is after it hit barriers and then slid through the parking lot. Officials arrested Eduardo Moreno. He says that he was targeting the Mercy because he was suspicious that the ship wasn't actually helping fight the outbreak. Well, thankfully, nobody was hurt. Now, with so many people staying at home, CMPD says that certain types of crimes are on the rise. One crime the police are seeing often is more shooting into homes or apartments. They reported 60 more cases of shooting into occupied dwellings in March than last March. That is an 80% increase.
The possibility of something tragic, if not deadly, occurring is there. We would like to ask, as always, the public's help in addressing that issue. If you have any information at all that could help address those crimes, especially any information that could help prevent those crimes, to give us a call.
Now, leaders also say that the problem of shooting into homes had been on their radar long before the coronavirus lockdown. They even formed a task force and done a social media blitz. But the problem is still there, and apparently it's only getting worse. And as if pregnancy isn't stressful enough, some new moms are now dealing with the reality of giving birth alone. One military mom-to-be at Fort Bragg says that her husband isn't allowed at her checkups because of the COVID-19 outbreak. She is due in June and says Womack Army Medical Center will only allow one person with her. So now she has to make the tough choice of having her doula or her husband with her during the delivery.
We're going to stay at home as long as we possibly can, but when it does come time to go to the hospital, I'll have to bring my husband.
Well, Tovar says that she will stay in contact with her doula using FaceTime when it is time for delivery.